The difference between you and someone with type 2 diabetes so bad that they're going to get their digits amputated is an extra 1 teaspoon of glucose in the bloodstream. That's how critical it is that we regulate our blood sugar. The most important part of blood sugar regulation is having muscles that are big enough to put the glucose into and that are insulin sensitive enough to respond to the signal of insulin. The other reason muscle mass and strength is so important is as we age, fragility and frailty become an enormous liability in death. Once you hit the age of 65, if you fall, which is pretty likely, and you break your hip or your femur, there's a 15 to 30% chance you will be dead within the next 12 months. Certainly, a loss of function is a big one. You can also just die as a result of hitting your head. You can die from a fat embolism or a blood clot, sepsis, heart attack. The 70 to 85% of people who don't die, 50% of them will experience a significant loss of function that never recovers after. This issue of sarcopenia, which is loss of muscle mass, and frailty and fragility become the absolute keeper of death for people once they reach the 7th decade of life.